Let's bring in Dr. Aditi Nerurkar. She's a physician at Harvard Medical School. Dr. Nerurkar, we're starting to see a pretty interesting trend develop across the U.S. States that are lifting restrictions are seeing a drop in cases, but states that still have some restrictions in place are seeing a spike in cases. What do you make of that?
Yeah, it's very interesting. It's a deceptive thing that we're seeing. What we see today is actually what has happened in the regulations that have been in place for about 3 to 4 weeks. So what we call in public health lagging metrics. First, there's an exposure. Then about 14 days later, we see positive cases of COVID. Lagging to that is hospitalizations, and lagging to that is deaths. So what we're seeing now is good public health practices that were put in place 3 to 4 weeks ago. But unfortunately, by removing restrictions, lifting mask mandates, opening up businesses, we're going to take a couple of steps back. And in 3 to 4 weeks, we may see a real rise in cases. So it's way too early to open up. We know that we need to make a concerted effort to keep things going to get this pandemic under control.
Doc, I want to ask you about some interesting numbers coming out of the UK right now. Some new data showing that in March, 53% of people who tested positive for COVID-19 did not have any symptoms. Do you think that's something we might see here in the U.S. too, a majority not having symptoms?
Great question, Aaron. You know, we are seeing that. So this really brings home the point that most of COVID transmission is invisible. In JAMA, the Journal of the American Medical Association, in January of this year, similar findings, 59% of those who were transmitting COVID, in fact, had had no presentations. They were what we call pre-symptomatic. And so most of COVID transmission that is happening and has been happening is invisible. All the more reason to have universal masking, hand washing, social distancing, and of course, getting your vaccine, which stops the spread of COVID. And that's critical, especially now.
All right. Goes back to what we've heard so often from during this whole time, this whole pandemic. Dr. Aditi Nerurkar, we appreciate your time. Thanks.
Thanks, Aaron.